Everyone, so previous lessons you have been looking at blood vessels, the blood and the circulatory system. So today we're going to move on to the heart and then helping the heart. So why are we learning this then? So obviously we all have a heart. We need to be able to understand how it works, what the structure is, what problems can arise within the heart, and then how can we actually treat this just to make sure that we can stay fit and healthy. So I'm going to do this lesson in two parts. So we're going to have the first section is going to be the heart, and then we're going to do some activities on that bit, and then we're going to do helping the heart afterwards, and again do some activities on that. So the learning outcomes for the heart. So we need to be able to state the main structures of the human heart, describe the route the blood actually takes through the heart, and then explain how the structure of the different parts of the human heart is related to its function. Right, so what I want you to do is pause the video here and have a go at this activity. So answers then. The first one, obviously red blood cell is transporting the oxygen. It's got the hemoglobin there to transport the oxygen around. White blood cell is to protect the body from infection. The platelets help to clot the blood, and the plasma transports blood cells, carbon dioxide and urea. Right, so the next few slides are all going to be pictures of the heart, and we're going to have a look at the different structures and the route that the blood takes through it. So what you've got to think about when you are learning about the heart and answering any questions on it is, as we look at the heart, the right and left are actually the opposite way round, because we're looking at it as if it's your heart within your body. So it would be your right and your left. So all you've got to do is just think swap right and left over. Okay, so the route that the blood will take will come through this blood vessel here, which we'll see on another slide, but this is called the vena cava, and into the right atrium. So if you look, we've got four chambers. So we've got the right atrium, right ventricle, left atrium, left ventricle, and always the blood will go into the atrium first. Okay, so from the vena cava into the right atrium, through a valve here, so that's just to prevent backflow, same as what you would have learned when you were talking about veins in the previous lesson. The valves are there to stop the blood going backwards. Then into the right ventricle. So to help you remember, for me, I just think, well, A is first in the alphabet, so atria would be first. Also, to tell apart which is the two, this one here, the ventricle, it's a little bit like a V shape, and so you can remember that it is the ventricle. So we're going in the vena cava, into the right atrium, through the valve, right ventricle, and then we're going to go up to the lungs, so through another valve, and this is the pulmonary artery. So pulmonary is lungs, so just remember that, and we're going out into the lungs. So what we're going to have travelling through here is our deoxygenated blood. So it's been around the body, the cells have carried out respiration, and they have deposited their carbon dioxide into the blood. And then that comes back into the heart and gets pumped to the lungs. So that's the first pump of the heart. The blood then goes into the lungs, and it then goes through the gas exchange, and we get the oxygen and we get rid of our carbon dioxide. So we're moving down to this side now, okay, and this is the pulmonary vein. So again, lungs, pulmonary, into our left atrium. So again, A, atrium, beginning of the alphabet, through another valve, again, preventing backflow, and then we've got our left ventricle, and then we go out to the main artery of the body, which is our aorta. Okay, so that goes out and it travels around, so all the places that it needs to give the body its oxygen. Okay, so we can see that the heart is obviously split into two here. So we've got a wall. Make sure that the blood doesn't mix. So we don't want the carbon dioxide, the deoxygenated blood, mixing with the oxygenated blood. So that's why we've got a double pump in our hearts. Okay, so just show you the other pictures quickly. Okay, so just the valve names. You've got your tricuspid valve here, your bicuspid valve here. Okay, just got the pulmonary artery and aorta on there, if you notice. So this is the artery. So this is the vessel that's leading away from the heart and going to the lungs. Also, this vessel is leading away from the heart and going to the rest of the body. So arteries are leading away from the heart. Okay, we've now got our two veins. So we've got our vena cava and we've got our pulmonary vein. Now, veins, if you notice, are leading into the heart. So we've got to make sure that we're remembering the right way round. Okay, and that's all of them on there. So the final thing that I want you to look at is the muscle tissue of the heart. So on our side over here, it's quite thin compared to this side over here, which is quite thick. Now, the right side of the heart, okay, the deoxygenated blood, is just coming into the heart and being pumped to the lungs. So it doesn't have very far to travel. So it doesn't need a very thick wall of muscle to pump the distance that it's got to go. Whereas this side of the heart, so the left side, is going to go all around the body. So what we need here is a nice thick muscle so that it can put the blood under more pressure and pump it around the body. Okay, so the function of the heart is obviously to pump the blood to the lungs and then around the body. So what is actually happening at the lungs? So we've got deoxygenated blood entering from the heart. The hemoglobin in the red blood cells is going to pick up the oxygen and then becomes oxygenated. So it's hemoglobin plus your oxygen gives you oxyhemoglobin. Okay, in the body parts then, we've got the oxygenated blood travelling from the heart around the body. The oxygen is then going to be used up in respiration to give us energy. So the blood is then deoxygenated. So you've got your oxyhemoglobin to start with. Okay, the oxygen comes away and is going to the cells, and you're left with your hemoglobin going back round. Okay, so I want you to pause the video here, and I'd like you to have a go at labelling the heart. Okay, so here are the answers then. So we've got, I'm going to start at the top here. So slightly different picture here to the one that I showed you before, because we can see that we've got the vessels coming off. Now that's just obviously because the aorta is going all around the body. So the top one, but it is over on the left side of the heart, is the aorta. You have got the vena cava. Now we've got some other ones around here that look a bit like, where are those bits going? So you have got the top half of the body, the bottom half of the body. So the vena cava, there's actually two vessels that lead into our right atrium, which is your next one down. So you've got your right atrium here. You've got your valve, which is your tricuspid valve. You have got your right ventricle. So over to this side, we've got our pulmonary artery. Okay, we have got our left atrium. We've got our pulmonary vein. We've got our valve again, which is your bicuspid valve, and your left ventricle. So sometimes in exam questions, you might have to label them or name the structures. You may have to draw arrows on. I've seen an exam question before where you've got to draw the arrows. So making sure you are clearly showing, so don't just draw one arrow up, one arrow down, just make sure you're showing where the blood is flowing through the different parts of the heart, so through the four chambers, in through the veins and out through the arteries, and make sure you get it the right way round. You might get an exam question asking you what the double pump is, so making sure that you obviously know we've got to keep the oxygenated blood separate, and so we pump the right side goes the deoxygenated blood to the lungs, and then the left side is for the oxygenated blood around the body. Another exam question that you could get asked is about the thickness of the muscle. So making sure you're remembering that the left side of the heart is thicker than the right, and that is because it's got to pump the blood under more pressure as it needs to go all around the body and not just to the lungs. Okay, so another recall task for you. So pause the video here and see if you can complete this flow diagram with the different parts of the heart. Okay, so the answers. Right, so we're starting with the body, going into the vena cava, right atrium, right ventricle, pulmonary artery, lungs, pulmonary vein, left atrium, left ventricle, aorta, and back to the body again. Okay, so I'd like to pause the video here and have a go at the comprehension questions that are in your booklet. Okay, so the answers to those comprehension questions. So what is the name of the blood vessel that supplies the heart with oxygen? So that is the coronary artery. So that wasn't on the diagram that I showed you. Okay, so none of the blood that goes sort of through the chambers of the heart is actually supplying the heart with the oxygen that it needs. That is by another blood vessel, and that is the coronary artery. What is the name given to the top chambers of the heart? So atrium or atria for both of them. What blood vessel supplies the left atrium with blood? And it is the pulmonary vein. What blood vessel supplies the right atrium with blood? And it is the vena cava. Okay, so learning outcomes, we've managed to achieve them. We know what the structures are. We can describe the route of the blood takes through that heart, and then we can explain how the different parts of the body and the lungs is related, the deoxygenated and oxygenated blood, to the function of the heart. Right, so the second part of this lesson is all about helping the heart. What we need to do by the end of this is state what coronary heart disease is, describe the problems that can develop in blood vessels in the human heart and their treatments, and then evaluate in detail the different methods used in the treatment of the heart problems. So basically we need to know what the advantages and disadvantages are. Okay, so first of all, we're going to watch this little video.
Approximately 7 million people around the world die from heart attacks every year, and cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not be able to pump blood as well, and its rhythm might be thrown off. In the worst-case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect your risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you've had one before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training. A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains, and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those known to be at high risk. And drugs that help manage risk factors, like high blood pressure, cholesterol, and diabetes, will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.
Okay, so we looked at what coronary heart disease is. So it's obviously the blockage, so the buildup of plaque and the blockage of the coronary arteries. And there were some different methods of how we can treat that. So we're going to take a few of those that you need to know about for your exam and have a look at them. But the first thing I want to say, another picture of the heart here, which is showing these blood vessels. So these are the coronary arteries. So these are found on the outside of the heart. So all of the things that we looked at earlier, all of the chambers and the blood vessels that are leading in and out of the heart, they don't actually provide the heart with the oxygen that it needs. Okay, it is the coronary arteries found on the outside that are supplying the heart, and they're the ones that we're talking about when we talk about the blockages. Okay, so if you can have a go at this recall task that is in your booklets, please. So pause the video and do that now. Okay, so the answers. So you should have written, when the fat build up, the blood flow through the coronary artery becomes blocked. So change coronary. This means the heart muscle will not get enough oxygen, so not carbon dioxide. This means that the muscle will not be able to aerobically respire, so will die. This causes the heart attack. So it's aerobically, it's with oxygen, not anaerobically. Right, so let's have a look then at some of the methods that we're going to be helping or using to help coronary heart disease. So we've got stents, which was mentioned in the video, statins, valve replacement, and artificial heart, and then obviously finally is your heart transplant. Okay, so first of all, a stent. It was in the video, so we need to know, what is a stent? So this is what we're talking about when we're saying that we might get a buildup of plaque. So if these vessels are getting too built up, so blockage is forming here, then we can use a stent. So this is like a metal mesh substance, and it gets inserted into the artery. A balloon is then inflated. Okay, so it opens out that mesh and it pushes open the blockage, and then the balloon is taken away and deflated. So it's basically a method of trying to open out the blood vessel to make sure that the blood can still flow through it and we can still get the oxygen. So our advantages and disadvantages then. So our advantages, it's lower the risk of heart attack, no need for general anaesthetic, so less risk, can be used almost anywhere in the body. The disadvantages, cannot be used where there is a badly blocked artery. So it's not going to, if it's really, really blocked, it's not going to be able to sort of get that mesh through in the first place to be able to inflate it. There's a risk of infection, so there's always a risk of infection during any surgery. And then there's a risk of developing blood clots near the stent thrombosis. So if you develop a blood clot like what was in the video, then obviously it's going to block the artery as well. The next one is the statin. Now, what we need to know here, this diagram is looking at LDL and HDL. So it's looking at the cholesterol that's actually causing the blockage in the first place. The LDL just stands for low density lipoprotein, and the HDL stands for high density lipoprotein. So if you're eating a lot of your saturated fats, sort of the unhealthy foods, then it's going to build up the LDL, so the cholesterol there. And then if you're eating more healthy foods, you're going to have the high density lipoprotein. So you do need some cholesterol in your body, but we're wanting this kind of cholesterol and not this one. So the LDL cholesterol, that's going to obviously deposit and cause the blockages, whereas the HDL is actually the one that comes in and tries to scoop away some of the LDL. So you do need that HDL in your diet to try and make sure that your arteries don't get blocked. Right, so your statins then. So statins are a group of medications basically that can lower the amount of the bad cholesterol, so the LDL in the blood, and they also stop the liver from producing the LDL as well. So if we can get rid of the amount of LDL, then it means that we shouldn't get the blockage in the first place. So these are obviously medication tablets that you would take. So advantages. It's lowering the risk of heart attack, strokes and coronary heart disease because we're not getting the plaque build-up. Increase the amount of good cholesterol called the HDL, and obviously if we can increase the amount of the HDL anyway, then we can remove that LDL. The disadvantages, you must take it regularly, so you will be on this medication and you must remember to take it. You might get some side effects. So with all medication there are side effects, and with this one it could be headaches, nausea and nosebleeds. There are also more serious side effects from taking the medication, so kidney failure, liver damage and memory loss. Okay, so another problem might be that people have faulty or leaky valves. So the valves no longer prevent backflow of the blood fully. So the treatments for this are valve replacements. Now there's two different types. There is the biological and the mechanical. The mechanical ones are made from really strong materials, so they're made from titanium and polymers. They can last for up to 20 years. However, you have to take anticoagulation drugs for the rest of your life. So this is to prevent the blood from thickening and to clot around that area. And also, when the valve's opening and closing, it can also make a click sound. So you can hear a click sound every time that valve's open and closes. There also might be damage to the red blood cells as they pass through those valves. Now, obviously, you've got to think about the advantages and the disadvantages, and the advantage here is the fact that you're not going to have it replaced for over sort of 20 or around about 20 years. Your biological valve replacement, they're normally taken from animals like your pigs and your cattle. There is no anticoagulation medication needed for these ones, and they do work really, really well. However, they only last for around 8 to 10 years, so they are going to need replacing a lot more often. There isn't a sound so no click when it opens and closes. There's also no damage to the red blood cells as they pass through, but they are prone to sort of hardening up, which is why they need replacing sort of quicker than the mechanical ones. So you just need to think about sort of the advantages and disadvantages of each of them to come up with the conclusion of which one would be better. Okay, so the next thing I want to talk about are pacemaker cells. So we have sort of a natural resting heart rate, so how quickly the heart will pump when you're resting. And you have what's called pacemaker cells that make that heart pump at the right amount. However, these can get damaged and they can stop working properly. So if the heart beats too slowly, then you're not going to get enough oxygen. So you're not going to get the blood pumped around, you're not going to get enough oxygen and therefore not enough energy. Also, if the heart beats too fast, then the blood can't pump properly. So therefore, again, you're probably not going to get the right amount of oxygen around the body. Now, what we can do is to have an artificial pacemaker fitted. So this is what we're talking about when we're looking at pacemakers. So it's an electrical device and it's fitted in the body here. And it basically makes sure that the heart beats correctly. So it's not too fast, not too slow. It's a natural resting heart rate. And basically it just sends electrical signals to stimulate the heart to work properly. And the final treatment that we're going to talk about is the artificial heart. So when the heart stops working, so it's not going to be working correctly and there's no other treatments. Obviously, you be put on a donor list, but that waiting list is really, really long. So if sort of your heart is getting to the point where it's not going to work correctly and doesn't look like there's a chance of a donor, then they can fit an artificial heart. Okay, so I'd like you to go back to your booklets now and complete the comprehension question. So press pause on the video. Okay, so answers then to those comprehension questions. So what are the two methods of replacing heart valves? So we've got mechanical and biological, and then advantages and disadvantages of each of these methods. So mechanical, advantage is that they are strong and they last for over 20 years. Disadvantages, they can hear the click, they need to take the blood thinning medication for the rest of their lives. Biological advantage, you don't need the anticoagulation medication. There's no risk for the damaging of those red blood cells. The disadvantage is that it hardens, so therefore it only lasts for about 8 to 10 years. What is the danger if a person's heart beats too slowly? The person's not going to get enough oxygen. What is the disadvantage of wearing a pacemaker? You are going to need regular checkups throughout your life. Why are artificial hearts used? So when a person's heart stops working completely and there's not a donor available, you will need an artificial heart. And what is the risk of artificial hearts? It is blood clotting. So we've now completed the second set of learning objectives. So we now should know what coronary heart disease is. We should be able to describe the problems that can develop in the blood vessels of the heart and then their treatments. And then we should be able to evaluate those methods. So looking at the advantages and disadvantages. Okay, so that is this lesson now completed.